Greetings. This is the first video in a series called Food in Focus. And in this series, I am trying to demystify some of the misconceptions we have about food. So I'm going to be talking about a whole bunch of different topics. A lot of people have ideas about, and they have questions about, and there's conflicting stories about it. And so I'm going to try to demystify that. And by the way, if this is your first time here, my name is Denise, and I welcome you here. And if you are returning and are finding my videos useful, please consider liking, subscribing, and doing so will help my very new channel grow. This is a very new channel for me. I just started just a few weeks ago, and I've got a few videos out, and I'm hoping to get them going quite a bit more. All right. Okay, so today we're talking about gluten-free. Gluten-free has become popular in the past decade, and I'm going to take a few minutes to answer common questions and clear up some of the misconceptions about gluten-free. Now, a disclaimer, I am not a dietitian. I am not a doctor. I have an undergraduate degree in nutrition and food science, and I worked in health for 6 years. And I have personal experience with celiac disease. I personally have that, and I have been on a gluten-free diet for, I don't even know how many years now. Okay, so gluten-free. What exactly is gluten? All right, in simple terms, gluten is a type of protein found in grains. All grains across the board contain gluten. However, wheat, rye, triticale, and barley have a different type of gluten that many people are sensitive to, and some people have an autoimmune response to gluten if it is eaten. And this is called celiac disease. And some of the other names for celiac disease are celiac sprue, non-tropical sprue, and gluten sensitive enteropathy. And those are just some of the different names. If you go to different countries, they might call it something different than celiac. When someone with celiac disease consumes a gluten-containing food, it affects the small intestine and often results in symptoms such as diarrhea, bloating, fatigue, and malabsorption. Malabsorption is the big thing with celiac disease. And sometimes weight loss, or even curiously, weight gain sometimes with celiac disease. However, some people might have no symptoms whatsoever and have the damage to their small intestine. And if that's the case, and in any of the cases, malabsorption can result, if you are not on a gluten-free diet, the malabsorption can result in mineral deficiencies and other nutrient deficiencies. Osteoporosis is common among people with celiac. People with celiac disease can treat this autoimmune condition simply by avoiding gluten. That's the only way to do it, and that is pretty much what if you do that, then you're controlling the disease. Basically, if you have a gluten-free diet, then you can live just like everybody else does. And that means strict avoidance. So there are no sort of the celiac diet, there's no such thing. And there's also no cheat days. And there's absolutely no other treatment available. So there's no medication that you can take. Now, I'm going to do all of these focus on food with some true or false. So I'm going to give you about 5 seconds to answer a question, in your head, just, like, is this true or is this false? And then I will answer it the best that I can. All right. Now, true or false, gluten-free food is healthier than the non-gluten-free option. Is that true or false? So 5 seconds. Okay, That is false. At least not necessarily. If you are choosing a gluten-free option for like a muffin or a baked good, the gluten-free options are no healthier than the regular ones. There's really no difference in them. It's just a different type of flour that they're using. However, foods that normally contain gluten are often, but not always, lower in nutrition by nature. And that's just because one of the main sources of gluten in our diet is just plain flour that has gluten. So another true or false question. I can safely follow a gluten-free diet even if I am not gluten sensitive. So 5 seconds. So that is true. You can, even if you're not gluten sensitive or if you don't have celiac disease, but it is not recommended. If you do not have celiac or if you have no issues with gluten, there is no reason whatsoever to follow a gluten-free diet. If you want, it will not hurt you, but generally it is not recommended because the more food restrictive your diet is, the more likely you are not meeting your nutritional needs. And if you want to go for the gluten-free foods, go for the ones that are healthier. So go for the ones that are more nutritious. Get your carb-rich foods from fruits and vegetables, whole grain rice, potato, corn, instead of chips. A lot of the chips are gluten-free and they're not very nutritious. And also avoid the gluten-free baked goods. They're no healthier than the other ones. Okay, so next, true or false? Breads and other baked goods are the only foods that contain gluten. True or false? That is false. Okay, so here we have a picture of a meat. And believe it or not, that meat has gluten in it. So a lot of people aren't aware of that. And they think, well, why would there be gluten in meat? Well, for two reasons. Sometimes the meat has fillers in it like flour and sometimes breadcrumbs, as a binding agent. And sometimes it contains soy sauce. Now, soy sauce has wheat in it just generally. It does. It's made with wheat and soy and water and a few other things, I think some salts and stuff like that, unless you get the gluten-free alternative, which is tamari. That is completely gluten-free, but soy sauce has a lot of gluten in it, and a lot of meats do contain soy sauce. So you have to watch out for that when you are choosing a meat if you are going gluten-free. So if you want to go gluten-free and you're not sure, what ingredients to look for gluten-free on the label. And just look for like gluten-free ingredients and things like that. But if a lot of companies want to advertise that it's gluten-free because usually that costs more. So if it's gluten-free, it usually says it somewhere. It's got that little logo on it, and then you can rest assured that it is gluten-free. Okay, next question. Corn and rice contain gluten. True or false? True. They do contain gluten. However, the gluten is a different type of gluten than what we are usually talking about, like with the wheat, the rye, the triticale, the barley. It's a different type. And so people who have celiac disease or some kind of issues with gluten, they are gluten sensitive, then the gluten that's in the corn, the rice, and other grains, oats, usually there's no issues with them with most people. But it does contain gluten. So don't let that confuse you. Yes, but this rice contains gluten. does that mean that it's not gluten-free? Well, when they talk about gluten-free, they are talking about the type of gluten that causes people to have a reaction to it. Next question. A gluten-free diet is a weight loss diet. True or false? That is false. A gluten-free diet is one that you're just eliminating the grain, protein, gluten from the diet. That's it. It has nothing to do with calories. It has nothing to do with carbs. It has nothing to do with weight loss or even nutrition. On a gluten-free diet, you can lose weight. You definitely can lose weight. You can also gain weight or be weight stable. It depends on your food choices, period. Now, is it easy to follow a gluten-free diet? Some people say it's very difficult. I've talked to people that have been following one, and they say it's difficult, but I am not finding it difficult myself. I have followed a gluten-free diet for decades now, and it's not that difficult. Sometimes eating out can be a challenge because sometimes they don't even know if something is gluten-free or not. And they're looking just for something that has flour in it or something that has bread in it. And if it doesn't, they're just assuming that it doesn't. So then you don't take those chances. And just stay away from spaghetti restaurants because there's absolutely nothing on the menu that you can have at a spaghetti restaurant. And if you're just going for the wine, that's fine because wine is gluten-free. But otherwise, stay away from spaghetti restaurant. And reading ingredients in grocery stores can be tedious because you got to look at everything, and all the little different things that it's disguised as. And when you need reading glasses like I do, and you don't have them when you're in the store, you're like, God, the label up to your face, but it's not that bad. Once you get used to it, once you get to know that, especially the products that you choose all the time, you don't even have to look. But if you're choosing something new, you got to check. And checking, like just going through it with a fine-tooth comb to see if it is definitely gluten-free before you eat it. Okay, so that's about it. So just a note before I leave, if you suspect that you have celiac and that there is a blood test that you can have done. So you would ask your doctor to have that blood test. And a positive test pretty much confirms celiac disease. And your doctor would know the test, the type of test to do. Not 100% confirming it because there are some false positives, but generally, if you have that as a positive, then you might as well treat it as being celiac. But a negative test is inconclusive. So if you are negative, then that doesn't mean you don't have it. It means you probably don't, but it doesn't mean that you don't. But one thing to pay really close attention to, because some of the doctors forget to tell you this, you have to be consuming a gluten rich food for 3 days before you have that test. So if you're going test on Wednesday, so I'd say, then it's like Sunday, Monday, and Tuesday, you would be eating food that has gluten. So you'd be eating bread, or you would be eating muffins, or something that's flour, something that is soy sauce every day for that 3 days before. And then for sure that you would have that response if you do have celiac. That's really important to do before, because if you are on a gluten-free diet, then you are going to be negative. Okay, so I hope that answers your gluten questions, and I hope to see you in another food-focused video, and I've got lots of them coming up in the next little while. Thank you so much for watching.